Hi, I'm Dr. Nancy Wood with an update on the latest happenings in Africa. In the midst of uncertainties around the world due to the COVID-19 pandemic, life goes on in DR Congo. COVID has not hit the Congo or Africa as predicted. That's good news. Epidemiologists foresaw a best-case scenario of 300,000 COVID deaths and a worst case of 3.3 million deaths and 1.2 billion infections without mitigation measures. The World Economic Forum substantiated this by declaring that in Africa, deaths from COVID might far exceed what the world is seeing. Now, 7 months later, Africa has recorded only 1.2 million cases and only 36,000 deaths. That's 1/10 of the best case and 1/100th of the predicted worst-case scenarios for the continent. In the CME hospital in Bunia, a city of 1 million people, in the last 7 weeks, they have only had 5 deaths, yet it is designated a COVID-19 treatment center. The continent's dramatically young demographic may be sufficient to explain it as the main driver of the African COVID experience. It may also be that most Africans have a certain general immunity from BCG vaccine. A study has just started in Toronto to try to verify this possibility. The new General Director of the Nursing College of Nyankundi, Maurice Mutronigo, is now functioning in his new role after completing his PhD. The college and university students who missed 4 months of classes and had no access to online learning are expected to finish exams soon, and graduation is set for late November. The opening of the new academic year is set for mid-December. We have been advised of the courses that the team want us to teach when we return in January 2021. We want to continue to equip local leaders and healthcare professionals. We are looking for Canadian, US, or UK partners to join us in various roles to offer encouragement and teaching to the young specialists who are all 5 years or less out of their training in Africa. The CME hospital would really appreciate an orthopedic surgeon to encourage the lone general surgeon, Dr. Sammy. In October, the hospital received a new digital X-ray machine. If you are a gynecologist with experience of gynae cancer, you'd work alongside Dr. M.A. We need an ophthalmologist to encourage Dr. David, who qualified in September, and a pediatrician to team up with Dr. Justin. Especially one with experience in infectious diseases would be welcome. An internist with a focus on diabetes and hypertension could really help the young generalist who sees these patients. We're also looking for a pathologist with experience of histopathology techniques. Most of the young doctors have a good command of English. There is also opportunity for teaching medical students at Shalom University in Bunia. An ability to teach in French would be an asset. Unfortunately, at present, there's a 14-day quarantine for people arriving from outside Congo. But 2 weeks of quarantine, followed by 2 weeks of clinical work, could be very useful and ultimately benefit the community at large. There are very few other qualified specialists in the whole of Ituri province, of which Bunia is the capital. If you think you are suitable for any of these opportunities, please feel free to contact me for further information by email or by phone. Another way to strengthen the DR Congo Christian leaders is to enable some to get further training. Monthly allowances, rental, travel, and research expenses have all been paid month by month for the 4 specialists in training, 3 PhD candidates, 3 master's students, and 4 undergrads. Thank you for helping us serve those in need by equipping healthcare professionals in Africa to better serve their own communities.